This is Outbreak News This Week, brought to you by the Global Dispatch Incorporated. Outbreak News This Week is your source for all the news about worms and germs. And now, your host, microbiologist and editor of OutbreakNewsToday.com. Here's Robert Harriman.
Well, hey everybody, this is Robert, and welcome to today's show. Well, it's been the goal of Democrats, going all the way back to FDR, to create a universal healthcare system, guaranteeing healthcare for all. Now, the Affordable Care Act was critically important, a big step towards the goal of universal healthcare. And thanks to the ACA, more than 17 million Americans have gained health insurance, according to Vermont Senator Bernie Sanders. But as we move forward, we must build upon the success of the ACA to achieve the goal of universal health care. According to Sanders, 29 million Americans today still do not have health insurance, and millions more are uninsured or cannot afford the high co-payments and deductibles. Americans need a healthcare system that works for patients and providers. Sanders says we need to focus our federal investments on training the healthcare providers. We need to build on the strength of 50 years of success of the Medicare program. Well, I'm not sure how successful Medicare has been. Yes, it is incredibly popular because people are getting back way more, 3 times more than they ever put in. Social Security and Medicare trustees report came out, over the summer, and they say Medicare's in worse shape than Social Security is. The trustees report estimates that the healthcare program for seniors will hit technical insolvency by 2026, 3 years sooner than last year's estimate. The program's worsening financial condition is traced to higher than anticipated spending in 2017, legislation that increases hospital spending, and higher payments to private Medicare Advantage plans. So, to say that Medicare's in the greatest thing since sliced bread over the past 50 years is not quite accurate when you have, trillions of dollars in unfunded mandates also. But Sanders continues to say, we need a healthcare system that significantly reduces overhead and administrative costs and complexity. We need a system where all people can get the care they need to maintain and improve their health when they need it, regardless of income, age, or socioeconomic status. And then, of course, in classic Bernie lingo, we need a system that works not just for millionaires and billionaires, but for all of us. Yeah, well, true enough, America's healthcare system is a mess, but it's hardly considered free market. It's got government entanglements all woven through in it. So to say that it's just pure private sector insurance company business, it's so far from the truth. Now, Bernie says that people would be able to start new businesses with Medicare for all, right? Stay home with their children or leave jobs they don't like anymore. Something they may not be able to do if they were concerned about healthcare coverage. Well, now employers could be free to focus on running their business rather than spending countless hours figuring out how to provide health insurance to their employees. Well, all right, Bernie, how about the income tax and all the taxes that our companies have to spend umpteen hours on with accountants and everything, trying to get everything straight to satisfy their bill to Uncle Sam. And then he says, millions of people would no longer have to choose between healthcare and other necessities like food, heat, and shelter. Not quite sure how often that happens, but okay, I'll leave that. Now, Bernie's Medicare for All plan is a single-payer healthcare program, right? Universal single-payer. And it means in this case, unlike a lot of the single-payer healthcare that he proclaims to love so much, like in Europe and in Canada, he wants this, comprehensive coverage for all Americans, right? That would mean everything. Inpatient, outpatient care, preventive emergency care, and long-term, and vision, and hearing, and oral health, and prescription medications, and everything else under the sun. I know for a fact that they're not getting that in Canada, and probably not in Europe either. So what does this mean for patients, according to Bernie? As a patient, all you would need to do is go to your doctor and show your insurance card. Bernie's plan means no more copays, no more deductibles, no more fighting with insurance companies that when they fail to pay for charges. Lollipops, right? Lollipops and unicorns. It would be all so perfect. And he says this is a great way to get healthcare spending under control. Creating a single public insurance system will go a long way towards getting healthcare spending under control. Moving to an integrated system, the government will finally have the ability to stand up to drug companies and negotiate fair prices for the American people collectively. Well, we're going to get into the spending in a moment. And what is Bernie saying? Bernie says his plan would cost over $6 trillion less than what we have today over the next 10 years. Not sure where they got these numbers from, but we do have some numbers from some other organizations that speak differently. Bernie says that, last year, the average working family paid, $5,000 in premiums and $1,300 in deductibles to the insurance companies. Under his Medicare for All plan, a family of four earning $50,000 would pay just $466 per year. Okay. Businesses would save almost $10,000 of healthcare costs for every employee. What's the bill? Bernie says his plan has been estimated, doesn't say by whom, but he said it's been estimated to cost $1.38 trillion per year. And of course, he's funding this through a myriad of tax increases, including income-based healthcare premiums paid by employers, a income-based premium paid by households, so more tax increases, right? He's talking about progressive income tax rates, so some people will be paying significantly more, from like 37% to more than 50% more in taxes. He wants to tax capital gains and dividends, just like income is taxed. He wants, he calls a quote-unquote responsible estate tax. So, yeah, a lot more taxes would be coming with the Bernie Sanders plan. So, what do other people say is the cost of Bernie Sanders' Medicare for All plan? Well, the Mercatus Center up at George Mason, of course, over the summer, they did a report analyzing the cost of a national single-payer healthcare system. And they say that the desirability and practicality of this kind of healthcare system that Senator Sanders is putting forward depends on, several things. A large measure on the cost. What are taxpayers are going to have to pay for it? So they say it would put an unprecedented strain on the federal budget. Medicare for All would add approximately $32.6 trillion to the federal budget during the first 10 years of its implementation from 2022 to 2031, significantly higher than what Senator Sanders is saying. So you're talking $3.2 trillion a year, which is clearly conservative and which is clearly going to go up year after year. The projected increase in federal health care commitments would equal approximately 10.7% of the GDP in 2022 and nearly 13% of GDP in 2031, and continue to rise thereafter. Now, these estimates are conservative because they assume the legislation achieves its sponsor's goal, Sanders' goal, of dramatically reducing payments to health providers, in addition to substantially reducing drug prices and administrative costs. Well, we'll see about that in another piece I'm going to be talking to you about. A doubling of all currently projected federal, individual, and corporate income tax collections would be insufficient, they say, to finance the added federal cost of the plan. So Medicare for All's dramatic federal cost increase arises from several factors. First and foremost, the federal government would become responsible for financing nearly all current national health spending. That includes individual private insurance and state spending. It would increase federal health spending on the currently uninsured as well as those who are now carrying insurance by providing first dollar coverage of the healthcare expenditures across the board without deductibles and copayments. And it would expand the range of services covered by federal insurance. For example, we're talking about adding dental and vision and a hearing benefit, all these things that would cost some money. Medicare for All would dramatically expand the demand for healthcare services. Of course, you put something out there that people aren't paying for, at least not out of their pocket, and tangibly. That's what happens when you put something out there for free. The demand goes through the roof. And that's consistent with economics research findings that the more of an individual's health costs are covered by insurance, the more services they tend to buy, irrespective of the service's efficacy and value. And we do not know how much Medicare for All would disrupt the availability and quality of health services, right? Medicare for All would markedly increase the demand for healthcare services while simultaneously cutting payments to providers by more than 40% relative to private insurance rates, reducing payments to levels that are lower on average than providers' current cost of providing care. So it can't even be known how much providers will react to these losses by reducing the availability of existing health services, the quality of such services, or both. Right? And, you know, in the CATO Institute, you can say, okay, well, they're a libertarian-leaning organization. Why do we care what they say? Well, the Urban Institute, about a year prior, I think it was maybe in 2016, did a very similar study. And this is what they said. Presidential candidate Bernie Sanders proposed a single-payer system to replace all current health coverage. His system would cover all medically necessary care, including long-term care, without cost sharing. We estimate, the Urban Institute, that the approach would decrease the uninsured by 28.3 million people in 2017. Right, of course, if you put Medicare for All out there for everybody, yeah, uninsured are basically going to disappear. Now, national health expenditures would increase by $6.6 trillion between 2017 and 2026, while federal expenditures would increase by $32 trillion over that period, essentially the same number that we got from CATO. Sanders' revenue proposals, intended to finance all health and non-health spending he proposed, would raise $15.3 trillion from 2017 to 2026. Thus, the proposed taxes are much too low to fully finance his health plan. So, even the Urban Institute is saying, nay, that's not going to work. And Bernie, your plan doesn't even address even close to the amount of revenue that's required to do that. And even with all your massive tax increases that you're recommending or suggesting or will enforce, it's still only going to pay just a sliver of the actual cost of this Cadillac single-payer healthcare plan for the United States that you want to put on them. Vermont Senator Bernie Sanders and 16 of his colleagues introduced legislation to guarantee health care to every American by expanding and improving Medicare, better known as Medicare for All, or in other words, a single-payer health care system or socialized medicine. To take a closer look at Medicare for All is CATO Institute Senior Fellow Michael Tanner. Michael, welcome to the show, sir.
Well, thank you. It's a pleasure to be with you.
Excellent. Now, I know you're familiar with the Sanders et al. Bill. Can you give the audience a summary of what they're proposing?
Well, essentially, this would be a single-payer system, a lot like Medicare is today, but much more generous. Basically, you would be able to go to any doctor that accepted payment, and the doctor would then submit the bill to the government, which would pay them. You would, in turn, of course, pay much higher taxes, but you wouldn't have any co-payments, deductibles, insurance premiums, and so on.
So do we know any specifics, like how much this government program would cost and how they would plan to pay for it all?
Well, we don't really know because this has not received scoring from the Congressional Budget Office. However, outside experts, including those at the Urban Institute, and folks from CNN have looked at it, and they've suggested that it's anywhere from $1.4 to $3 trillion per year.
Wow.
So that would be somewhere between $14 and $30 trillion over a 10-year period in additional government spending.
So, but as far as taxing authority, what's Sanders' plan, to go after the rich people again?
Well, that's always his favorite plan. He actually did not include any pay for in the bill, so there's no actual way to pay for it included in the legislation. He did, however, from his office, offer a number of suggestions, including a roughly 10 to 15% increase in the payroll tax, a 4% income tax on hike on all Americans, in addition to the payroll tax hike. Plus additional taxes on the rich and corporations as well. So essentially, we'd all be paying a lot more under his plan.
Now, the benefits that are proposed are pretty comprehensive, from emergency services to primary care, prescription drugs, mental health, everything to audiology. Now, how does this socialized medicine program compare to similar programs in Europe and Canada?
Well, this is much more generous than any program that we're liable to find anywhere else in the world. For example, the Canadian system, which Senator Sanders talks about a lot, does not cover the full cost of prescription drugs, but this would cover 100%. The Canadian system doesn't cover all the vision and dental care. This would cover 100% of vision and dental, and so on. This would cover more than, say, in UK. There'd be less out-of-pocket costs than, say, in France or Australia. This would by far be the most generous healthcare plan in the world.
Now, anytime you have a free government program, or anything that's free for that matter, that really skews supply and demand. Would you like to comment on that?
Well, certainly if this is free, it's going to increase demand. People are going to be quicker to go to doctors, and that's sometimes a good thing, sometimes not. But more people are going to want to see doctors. But at the same time, the senator wants to impose price controls. In fact, he wants to squeeze some $6 trillion over 10 years out of the current system by reducing rates of reimbursements to doctors and hospitals. If you do that, you're going to drive doctors and hospitals out of business, or out of the system at least. And that means you're going to have lower supply. You get common sense that if you have increased demand and lower supply, you're going to have shortages. That's sort of economics 101.
Exactly, and it's as if we didn't learn anything from the Nixon years.
Well, price controls have worked. I think Ronald Reagan used to point out that they didn't work back in the Roman Empire, and they used the death penalty to enforce them.
And so one of the concerns you mentioned is there a concern for doctor shortages. I mean, did we see that in Massachusetts?
Well, we face doctor shortages as it is. We're about 150,000 doctors short of what it's going to take just to take care of the population we have now as we age. And this is certainly not going to do anything to encourage doctors to go into the system. You know, Medicare already under-reimburses doctors, which is why about a third of physicians are either not taking new patients or not taking Medicare patients at all. That's an increasing problem in the existing system. Imagine expanding that to everybody.
Now, just talking briefly about the current Medicare program for seniors, you hear most people say that this is really, really a popular program, and I believe it is. My mother's on it. However, there's a reason for its popularity, and it's not fiscal responsibility or sound economics, is it?
Well, no. In fact, Medicare is promising benefits and paying benefits that it really can't afford. According to the trustees of the system, Medicare is some $50 trillion in the red going forward. It means our kids and our grandkids, of course, are not going to be able to get the benefits that today's seniors do. On the other hand, it provides a lot of benefits for people who aren't really sick. It pays for your checkups. It pays for your routine care, pays for your prescription drugs. For a lot of people, this is a pretty good deal. Now, Medicare, if you get really sick, of course, doesn't cover you. That's why you end up in Medicaid if you're in a nursing home. And it's not a good deal for our kids and grandkids who are going to put the $50 trillion that we owe.
All right, just to get a snapshot, what chance does Medicare for All have in the United States of America today? And is this something that we're probably going to see in the future?
Well, today it has exactly zero chance. There is no possibility whatsoever that it is going to get 60 votes in the United States Senate with a Republican majority. If every Democrat was for it, it still wouldn't come close, and not all the Democrats are on board. But it is a harbinger of things to come. If we look at who is co-sponsoring this legislation, it is almost everyone who's seriously talked about as a potential 2020 presidential candidate. So you see Cory Booker on board and Kamala Harris and people like that who have signed on. You see a lot of the intellectuals within the Democratic Party and the activist base supporting this. The Democratic Party is being driven left as fast as the Republican Party is being driven right by their activist bases. This could be a very interesting campaign issue come 2020.
Okay. And finally, Graham Cassidy never got a vote yesterday. I'd just like to get your thoughts on Graham Cassidy, the pros and cons, and the future of it.
Well, on the con side, Graham Cassidy didn't repeal much of Obamacare. Basically, it left all the spending and all the taxes in place. It simply changed how that spending was done. It delivered it back to the states in the form of block grants and changed the formula for those states, taking some money away from the Democratic states, particularly California, New York, and Massachusetts, then shifting that money out to more rural states that tend to be represented by Republicans. It did, however, give governors a little more flexibility in use of that money. That probably would have been a good thing. So it really fell short of any sort of repeal of the Affordable Care Act. Improvements would have just been on the margin, but it probably would have made some improvements. It would have certainly have gotten rid of the individual and employer mandates, which, of course, are very unpopular.
So can something like Graham Cassidy ever get 60 votes?
I'm not sure Mom, Apple Pie, and the flag could get 60 votes in this Congress right now.
Yeah.
Realistically, the problem is that health care is hard, as Donald Trump once said he discovered. What American people tend to want in terms of their health care is something that's almost impossible to deliver. They want all the health care they can get with a doctor of their choice and no wait, and they want it for free. I haven't yet figured out a bill that's going to do that.
Yeah, that's a utopia for sure. Well, thank you very much, Michael Tanner, for your thoughts, your time, and your expertise. I appreciate it.
Anytime. Always happy.
All right. Take care. Okay. After we come back from the break, we're going to take a look at a couple other things like have any states looked at trying to do single-payer health care? And what happened? What did they come up with? We're going to look at how Sanders' Medicare for All, how that compares with the Canadian single-payer system. Yeah, we're going to look at that, and we're going to look at, what are the administrative costs? Sanders and his ilk are saying that they'll go way down, but is that true? We'll see what Gary Gallus from the Mises Institute has to say about that in a recent article. And Again, the website is outbreaknewstoday.com, outbreaknewstoday.com, and we'll see you after the short break.
Welcome back to Outbreak News This Week, your source for all the news about worms and germs. Here's your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, welcome back to the program. Well, in the first half, we talked a little bit about how Bernie Sanders wants to raise our taxes quite dramatically, in fact, to try to pay for this Medicare for all, enormously expensive universal health care plan. Well, what do Sanders supporters think about that? Well, after the bill was introduced, there was a poll that asked, as you may know, presidential candidate Bernie Sanders has proposed federal tax increases to pay for his proposed government programs. How much more would you be willing to pay in federal taxes each year for a universal health care system that covers all Americans? And this is how Sanders supporters answered. 2/3 would be willing to pay somewhere between $0 and $1,000 in additional taxes annually and no more. In fact, about 1 out of every 10 Sanders supporters polled say they are not willing to pay anything, not a penny, for his single-payer health care program. So, yeah, there you go with that. Want the goodies, but they're not willing to pay for the goodies, right? And then, has this stuff been looked at the state level at all? And the answer is actually yes. And I'm going to report on 2 cases. Of course, more recently was California, and they have been looking at doing a single-payer health care plan for some time. And actually, the California State Senate commissioned a study, and they found some pretty ugly numbers. And it came out to be that the annual price tag for single-payer health care in the Golden State would be a whopping $400 billion. Okay, well, that don't sound like much as compared to the numbers we heard in the first half of the show, right? The problem is the total amount of money allocated for California state budget for the coming fiscal year was only $180 billion. Dope. Got a problem there, right? More than double the actual total state budget would just be single-payer health care. So, yeah, and this wasn't done by some right-wing or libertarian group, but this is the Democratic supermajority controlled California state legislature. So the harsh realities of what it costs to provide this long-held dream of a liberal Democratic Medicare for all type system in the state of California, they have learned that it's just not feasible. No big surprise, right? What about in Vermont? Vermont tried something similar too. They got about as far as California did. They never implemented anything, but they realized it was really, really pricey. And by the way, if you didn't know, Vermont is the state where Bernie Sanders is the senator. And Vermont has been working on trying to get single-payer health care up there for at least 4 years, I think since 2010. But then in 2014, the governor at the time ended the initiative to develop, enact, and implement a single-payer healthcare system in Vermont. His name was Peter Shumlin, and he said the plan, which was called the Green Mountain Care, would require a 11.5% payroll assessment on businesses and sliding premiums up to 9.5% of individuals' incomes. He said that would hurt the economy, so he scrapped it. The $4.3 billion per year cost of the plan would have been almost as much as Vermont's total state budget, shumlin Shumlin said, I have learned that the limitations of state-based financing, the limitations of federal law, the limitations of our tax capacity, and the sensitivity of our economy makes that unwise and untenable at this time. The risk of economic shock is too high. So, all right. So in Bernie's own state, they said, nah, we're not going to do this because it's just not feasible. All right. Well, the administrative costs are often mentioned when we're talking about Medicare for all, that it would be so much cheaper as opposed to what's going on now with the multiple insurance companies, with the multiple plans, et cetera, et cetera. And, there's some progressives in the Congress as we speak that are really, really pushing for the Medicare for all. Sanders himself argues that 70% of Americans favor it. So now is the time. But of course, as I kind of presented to you with his own supporters, that support does plummet when people are told about its astronomical tax bill and the escalation in government control. But Sanders insists that it will happen because the bottom line is that less money will come out of Americans' pockets to pay for health care. Well, unfortunately for that argument, its basis, that turning from an already heavily regulated market in healthcare to a far more governmental control would slash administrative costs, while it's repeated over and over and over, is basically false, according to this piece from the Mises Institute by Gary Gallas. He says, the lower administrative cost song has been sung since before Hillary Care. And Paul Krugman asserted that administrative cost savings would pay for Obamacare's expanded coverage. A policy literature provided apparent support. In general, people found Medicare's administrative cost to be about 3% of its total cost, while they were roughly 4 times higher for private insurance. If that difference was real, it could finance substantially expanded healthcare delivery, but it actually reflects poor measurements. Now, administrative cost as a fraction of total cost, the typical measure used, is highly misleading when comparing Medicare to other health insurance. Non-medical administrative costs are primarily a function of the number of beneficiaries, not the cost of their care. But Medicare patients are far older and less healthy, and more than twice as costly on average than younger people in private plans. But having less than half of the healthcare cost per beneficiary more than doubles private insurance's administrative costs as a percentage of the total cost than if the more accurate measure, administrative cost per beneficiary, was used. So in fact, Medicare's reported administrative cost per beneficiary has consistently exceeded that of private health insurance. Now, adding to this mismeasurement is that many of the administrative costs of Medicare are not counted in comparisons because they show up in other agencies' budgets. Social Security administers the collection of Medicare premiums. The IRS collects the taxes. The HHS pays for building and marketing costs, as well as accounting and related concerns. Attributing those costs correctly would roughly double Medicare's administrative costs. Imputing administrative costs to the correct program and adjusting to far more appropriate per beneficiary terms wipes out Medicare's supposed 4-to-1 administrative cost advantage over private insurers, eliminating the free money Medicare for all supporters rely on in their promises to deliver health care for less. But there are still more biases tilting the scales away from what everybody knows about administrative costs. Private insurance administrative costs are normally defined as premiums received minus claims paid, categorizing everything but claims paid as administrative. However, states commonly impose a premium tax, around 2%, on health insurers, but not on Medicare. Though not administrative costs, this is how they are counted. Many private insurers, including mine, offer disease management and on-call nurse consultation services, which, even though they are not medical, are counted as administrative costs because they don't generate claims. Now, fraud, a huge problem and a persistent problem for Medicare, also biases comparisons. If Medicare spends less to reduce fraud, it saves on measured administrative costs, and the unnecessary costs fraud causes are counted as medical costs. It looks more efficient, right? But because studies have found 15-to-1 payoffs for fraud prevention investments, when private insurers do more to combat fraud, their administrative costs go up, and their efficiency looks worse, even when they produce remarkable cost savings. Very key. I don't think a lot of people think about that. And we should also remember that current taxpayers fund most of Medicare, imposing another large differential but unrecorded costs, which economists call excess burden. Tax wedges between what buyers pay and what sellers receive eliminate substantial gains from trade, as well as directly taking resources for government. One study concluded that even the lowest plausible assumption about the excess burden engendered by the tax system raises the true cost of delivering Medicare benefits to about 20 to 25% of its outlays, far higher than any estimate of private insurance administrative cost. Expanding into Medicare for all would balloon these costs, as well as the direct cost of financing it. So Gallus closes by saying, those pushing for Medicare for all rely on the presumption that it would generate huge administrative efficiencies. That is such a useful basis for what they want to sell that they don't look into the heavily biased measures being used for their pitch. But as Ben Bernanke, former Fed chair, said, good decisions depend on good measurement. And the biased measurements being used result in garbage in, garbage out policy proposals, which would sharply expand government's commandeering of healthcare, do the opposite to America's well-being. So, yeah. So when people tell you that there's some massive costs there, cost savings, it's not quite true. And if you dig a little bit deeper and peel back some of the layers of the onion, it's pretty noticeable.
Vermont Senator Bernie Sanders has been the country's most outspoken advocate for a Medicare for all, single-payer healthcare system. He often pushes for a Canadian-style healthcare system, and he's not alone. A lot of his followers do the same. But when you look at his website, you can get a good bird's-eye view of what he's actually proposing. His universal single-payer healthcare system means to him, essentially, comprehensive coverage for all Americans. And we're talking about everything, inpatient to outpatient care, and preventive and emergency care, primary care, specialist, long-term care, eye exams, hearing, dentist, prescriptions. And it goes on and on. It's essentially this massive Cadillac plan. So how does Bernie Sanders' vision of single-payer healthcare compare to the current Canadian healthcare system? Well, my guest today, though clearly not an advocate of the Canadian-style healthcare, explains the differences and why the Sanders plan is actually worse than Canada's current plan in a recent article. So joining me now is Ryan McMaken. Ryan is the editor of Mises Wire and the Austrian with the Mises Institute. Hey, Ryan, welcome to the show.
Hi, good morning.
All right, well, I described how Sanders wants to do his healthcare plan, hugely expensive, take care of everything kind of plan, a Cadillac plan of sorts, paid for by the government. So what do we actually know about how the Canadian single-payer system works, and how is it different from what Sanders is proposing?
Well, let's start with what Sanders is proposing, which isn't entirely clear if you go to his website. I don't know if it's purposely vague or maybe they don't understand it. It's called, of course, Medicare for All, implying that this would just be an expansion of Medicare, how it's currently done. But Medicare in America is not a single-payer plan. But then if you read down on the Bernie Sanders plan, it says we would create a single-payer plan for the United States that would cover all of this. So is it single-payer or is it Medicare, U.S.-style Medicare? That they seem to conflict with each other. But let's take them at their word that they want to create a single-payer plan. The model then, of course, is that they frequently cite is Canada, which is a single-payer plan in the sense that there are medical services, certain medical services on a big list, if you will, only have a single payer, which is the government. And so anything that's on that list then is provided by what's confusingly called Canadian Medicare. It's also called Medicare in Australia, so we'll try not to get confused. But Canada style. And so anything on that list can only then be provided by the government under most circumstances. And you can't just go up and hang out your shingle and set up shop providing that in the private sector. And which, of course, you can, if something's offered in Medicare here, you can go supply it in the private sector too. But it's very different in Canada, where you're not allowed to compete with the single-payer system. And what a big difference you notice immediately then is if he's shooting for a Canada style, and at the same time offer all these services that they say they want to do on their website. So it's everything from long-term care to mental health to dentistry to eye exams. All of that stuff is what the Sanders plan calls for, either unaware or just ignoring the fact that Canadian Medicare, Canadian single-payer system, doesn't cover a lot of that, certainly not in the federal legislation. So the federal legislation, especially as updated back in the 80s, doesn't provide coverage for mental care. It doesn't, unless it's performed by a doctor in a hospital. It doesn't provide pharmaceutical coverage, for example. It doesn't provide long-term care. Now, some of that is covered at the provincial level, where the provinces have put in place programs that cover that or have defined those things as necessary to get some funding from the feds. But this is hardly the sort of blanket coverage that is requested and claimed is going to happen under the Bernie plan. And so this is part of the reason, of course, that Canadian government spending isn't completely out of control. It's because they greatly limit what is actually covered and mandated to be covered in their federal Medicare legislation in Canada. So if the Canadians were to start doing what Bernie wants to do, which is covering everything, then costs would absolutely skyrocket immediately, and they'd be facing a serious, serious debt problem. And then that's what Bernie wants to do here then, is just expand to covering everything.
Exactly, and I'm sure most Americans don't even realize this. And other than the amount of spending, why are these differences important for other reasons?
Well, of course, single payer is really one of the worst types of universal coverage, and that's what a lot of people don't realize, is that universal health care and single payer health care are not synonyms. They're not the same thing. There are other types of systems you can use. There's the Swiss system, which superficially actually looks quite a bit like Obamacare, the fact that everybody's required to buy insurance and that there's just a highly regulated market on the side. There's the German system where above a certain level of income, you're required to buy private insurance, and then below a certain level of income, you just go on what's essentially a government insurance program. There's Australia's Medicare system, which is basically a parallel private and public system. They had privatized part of the system to help take the pressure off wait times that were, of course, long when they had only the public system. And so there are all these different sorts of issues, and not all universal coverage systems are equally bad, and single payer is one of the worst. Because it basically outlaws private sector competition in most ways. But even worse than the Canadian system, however, is the British system, the National Health Service system, which has basically government-owned hospitals. Right. And everyone receives their treatment in these government institutions, which are then known for poor outcomes and for long wait lines. They point to life expectancy and things like that, but life expectancy really is mostly dependent on many other things, such as population, obesity, and drug use habits, and automobile accidents, and all that sort of stuff. Trying to connect that just to your health system doesn't really work. Which, if you look at specific disease outcomes and things like that, The National Health Service is starting to have some real problems there. But the larger issue is freedom, too. I mean, you're not even allowed then to purchase these goods in the private sector. And I wonder how much Americans would like that, where they wouldn't even have the option then of buying these things. I think most Americans love the idea of some sort of universal coverage. There's like a safety net, right?
Right.
And of course, the U.S. is moving in that direction rapidly now. It's now 138% of poverty rate. You're on you can qualify for Medicaid. I guarantee you within 10 years, it's probably going to be at 160% or so, which is what food stamps is at now. Probably within the next 20 years, it's going to be at like 300% of poverty rate, which is what the Massachusetts plan did under Romney. So it's just a matter of time. So you got basically this huge safety net and near universal health care. But the last thing you want, though, is a single payer type system which basically outlaws private competition and a private sector in healthcare.
Right. And the irony is that some Canadians actually want this Bernie-style plan, and they criticize the current plan. Any thoughts on that?
Well, yeah, it's assumed by Americans. It's this weird thing Americans and Canadians have. Canadians think that Americans are like dying in the streets because they can't afford health care. They think that like the paramedics, before they'll help you, will make you show your insurance card or provide them with a credit card in order to receive care of any time. Of any kind. They actually think this is a real thing where you have to like flash the cash before you can receive any health care in this country. And then at the same time, Americans think everything is perfect and everything is covered, that you never even have to worry about like a single bill in Canadian healthcare. This isn't true at all. There's lots of private coverage that has to take place. In fact, Canada has 30% private sector healthcare spending, which is higher than most countries in Western Europe. And so you have this raging debate right now among Canadians as they want, some left-wing Canadians want to greatly expand to pharmaceuticals and to mental health and lots of other issues. But there's the problem of, unlike the U.S., since the Canadian dollar is not this global reserve currency, they can't just keep printing money ad nauseum and just go deeper and deeper into debt like Americans can. So they realize that there are limits to how much you can spend on this stuff. So they've so far, in the last 20 years of attempting to greatly expand this coverage, have failed.
Okay. Ryan, any final thoughts on this topic?
No, I wrote the article because I was just peeved by the fact that everyone was speaking of Canadian healthcare in ways that really didn't describe what was going on, and acting like all universal coverage systems were Canadian-style single-payer systems, and that's just simply not the case. So it's a lot more helpful to actually look into some of this and be able to tell the difference between the different systems.
All right, it's a good article. I'll go ahead and post a link to it on the website when I post the podcast. And I want to thank you, Ryan McMaken, for your time and your expertise, sir.
Great. Thank you very much.
You bet.
All right. Well, I hope you learned something today about Medicare for All and some of the costs, some of the fallacies, and some of the damage that it would really do. I mean, look at Medicare as it is now. You know, it's about $700 billion a year, and it's covering only the elderly. And that cost is it's equivalent to what we spend on defense. Social Security is about $1 trillion a year. And there's just massive unfunded mandates that go along with it. Some estimates are in this like $70 trillion. Some go above $100 trillion. So it's like we're never going to get out of that. So introducing Medicare for All, I can't see that working out, particularly the way our bureaucracy works in the United States. All right, well, again, I want to encourage you to check out the website, outbreaknewstoday.com, and check out some of the stories there. And clearly the biggest story of the past week was this Johns Hopkins research about plant compounds that may be better than some of the current antibiotics in treating persistent Lyme disease bacteria. And that comes out of the journal Antibiotics, and that's been a monster story for us on the website this week. So I encourage you to check that out. Other things going on. Well, we got measles outbreak all over the place. Israel and different European countries, and right here in the United States. So we have a lot of problems with that. Anyway, check that out, and I'm going to wrap it up right now. So I'll see you next week on Outbreak News This Week. Good day, and God bless.
Thank you for listening to Outbreak News This Week with Robert Harriman. If you missed any part of today's program, you can listen to the podcast anytime on our website, outbreaknewstoday.com. Make sure to join us here next week for Outbreak News This Week with Robert Harriman.